The confirmed number of new coronavirus cases reported in Los Angeles County over the last 24 hours is 18,822, with 36 additional deaths. Here in Torrance, 156 additional cases were reported with no new deaths. Welcome to COVID-19 Today. I'm Christine Lee. It's Wednesday, January 26th. The world saw a record number of COVID-19 cases last week. The World Health Organization says 21 million new cases were reported globally, making it the highest weekly number since the pandemic began. Thankfully, the number of deaths held steady at around 50,000. The agency says the number of new infections rose by 5%, and the good news is it appears to be slowing. Only half of regions reported an increase in COVID-19 cases. The biggest spikes were seen in the Middle East, with a 39% jump, followed by Southeast Asia at 36%. Officials say it might be possible for the world to exit the acute phase of the pandemic later this year if goals such as immunizing at least 70% of each country's population are met. Meanwhile, they warn the public about becoming complacent or talking as if the pandemic might be entering its end game. They say conditions remain ripe for new variants to emerge, leaving the unvaccinated vulnerable to the rapid virus transmission. Speaking of new variants, about a dozen confirmed cases of BA.2, the Omicron Subvariant, have been detected in California. 2 new cases were found in Santa Clara County, bringing the total to 11 as of yesterday. Globally, more than 40 countries, including Australia, Germany, and India, reported cases of this new strain. Over 8,000 total cases have been identified since November 2021. The UK Health Security Agency and World Health Organization labeled BA.2 a variant under investigation, which is one step below a variant of concern. Some scientists dubbed it the stealth Omicron because it may be more difficult to identify in PCR tests. Medical experts say there is no indication that this variant is more of a threat. The Danish government released some data showing that so far they are not seeing increased hospitalizations due to this variant versus regular Omicron. It's not clear at this time where this mutation came from or whether vaccines are effective against it. Infectious disease experts are exploring if people who had the vaccine and Omicron could develop super immunity and be better protected against BA.2. Fake COVID-19 testing sites are popping up all over the U.S., including right here in LA County, and public officials are speaking out against them. LA County Supervisor Janice Hahn is renewing a call for a crackdown on these fraudulent sites. She says 6 locations in Bell Gardens and Southgate were recently shut down after authorities discovered they were fake. Hahn sent a letter to the County Department of Consumer and Business Affairs asking the agency to monitor pop-up testing sites to ensure individuals are not falling victim to fraud. She said it is despicable that some people are taking advantage of communities during a deadly pandemic, and residents need assurance that they will get accurate test results and that their information will be protected. Some of the sites charge people for tests without sending them the results, and others ask them for personal information. Public health officials remind everyone that legitimate sites should not ask for your bank information or your social security number. Earlier this month, Supervisor Catherine Barger introduced a motion asking county staff to develop an enforcement plan to crack down on these fake sites, as well as an education campaign to alert the public of the risk and point them to legitimate resources. A list of county-approved testing locations can be found at covid19.lacounty.gov/testing. And if you believe you've gone to a fake COVID-19 testing site or purchased a fake test, contact the LA County Public Health Department and file a report. Some hospitals are using a lottery system to allocate hard-to-find COVID-19 drugs. Last month, the U.S. Food and Drug Administration authorized Evusheld, a monoclonal antibody combination from AstraZeneca. It's designed to give immunocompromised people the added protection they need. For those who don't respond well to vaccines, shots of this drug put COVID-fighting proteins directly into their bodies. Analysis by AstraZeneca showed the drug reduced the risk of getting COVID-19 by 77%, and protection from a single 2-shot treatment lasted for at least 6 months. Early data suggests it may work less well against the Omicron variant, but should still offer some protection. There is a problem with this drug, though. It is in short supply. The federal government controls distribution and has shipped about 300,000 doses to healthcare providers and ordered a total of 1.2 million doses to date, but around 7 million people in the U.S. could benefit from this drug. The scarcity has forced some doctors to run a lottery to decide who gets it. Hospitals in Colorado, Florida, Massachusetts, Minnesota, and Washington all reported running a random system that picks out the lucky winners to get the much-needed injections. Meanwhile, in Alaska, they're having the opposite problem. Health officials there say they have not had the same demand and, in fact, are trying to reach out to oncologists to ask if they are even aware that this drug exists because they have supplies and think more people need to be reached. Health officials say the country's fractured healthcare system leads to inequities, and people who know where to go and what to ask for are the most likely to survive. California Governor Gavin Newsom and other state lawmakers reached an agreement on a framework to require employers to provide paid COVID-19 supplemental sick leave again. Under the framework, employees would continue to have access to paid sick leave through September 30th of this year. It would be retroactive and cover COVID-19 absences from January 1st. This affects workplaces with 26 or more employees. Workers who test positive or have to care for a family member with COVID-19 would get up to 2 weeks of supplemental leave. The framework will provide up to 40 hours of additional paid sick leave and another 40 hours if a worker or a family member they take care of tests positive. California previously had a COVID-19 supplemental paid sick leave law that expired on September 30th of last year. It required all employers with 26 or more employees to provide 80 hours of paid COVID-19 sick leave. The California Teachers Association supported the new paid leave agreement, saying it will ensure that employees quarantine, recover, and return to their classrooms healthy. State lawmakers say by extending sick leave to frontline workers with COVID-19 and providing support for California businesses, we can help protect the health of our workforce while also ensuring that businesses and our economy are able to thrive. They also said they'll continue working to address the additional needs of small businesses through the budget, as they are the backbone of our communities and continue to be impacted by COVID-19. A new study shows COVID brain fog is a real thing, and in fact, 30 to 40% of coronavirus patients develop cognitive symptoms. Researchers at UC San Francisco discovered a link between people with post-recovery brain fog and abnormalities in their spinal fluid that surrounds the brain. Dr. Joanna Helmuth, a neurologist and the study's lead author, says the spinal fluid abnormalities were found in study participants of all ages with differing degrees of infection severity. All were vaccinated before developing the cognitive impairment. Researchers found the more health risk factors someone has, the more likely they are to experience COVID brain fog. They also discovered that no participants' conditions worsened over time, but say it's too soon to tell whether symptoms may spontaneously disappear. They hope this and further studies will help develop effective treatments for COVID brain fog. Another study reveals interesting trends about this ever-changing virus. Researchers found that the severity of the disease with the Omicron variant is faring to be less compared to the Delta strain and the first winter surge. Data shows among patients hospitalized with COVID-19, about 13% were admitted to the ICU during the Omicron period, compared to about 18% during Delta and the first surge. Less patients also died during Omicron, with a 7% fatality rate compared to 12% during earlier peaks. Researchers say the severity of the disease could be lower during Omicron due to a combination of factors, such as higher vaccination rates, including more people getting their boosters at this point in the pandemic, and immunity acquired from previous infections. Researchers analyzed COVID-19 indicators for 3 periods of high transmission: the first winter surge in December 2020 through February 2021, the summer of July through October 2021 when the Delta variant was high, and then mid-December 2021 to mid-January as the Omicron variant emerged. Every other week, we share a Wellness Wednesday story to help you stay on top of this pandemic, both emotionally and physically. 2022 looks a lot like last year so far, and not in a good way. We've been telling you about daily COVID-19 cases climbing and hospitalizations going up as well. The Omicron variant has added another layer of stress as more people than ever are testing positive regardless of vaccination status, and a growing number of young children are getting sick with the virus. We've been in touch with local medical professionals throughout this pandemic, including Extra Urgent Care's Dr. Corey Spurlock, and he is joining us again to help us make sense of this latest surge and answer some of your questions. Thank you for being here, Dr. Spurlock.
My pleasure. Happy New Year.
So it's been a few months since I visited you at your Torrance clinic, and I remember you showing us COVID testing capabilities there. What has the testing demand been like since the Omicron surge began?
Yeah, it's been significant. I mean, over the past 2 years, the demand has been steady. But over the past 2 weeks with the latest surge, our testing numbers have skyrocketed. We're testing probably on average about 1,200 patients a day total, every day of the week. And so that equates to some weeks close to 10,000 patients that we're testing across all 27 facilities. And so it's been busy, very, very busy.
Wow. And what about wait times? Are they affected due to this current rise in cases?
I think a little bit. Fortunately for us, before this surge and during as a result of what we've learned over the past couple of years, I think we've all been, no matter what industry you're in, you've learned and been able to pivot. So, we brought online a virtual line and an appointment-based system for our COVID testing for, patients who are not really symptomatic or don't need to see a provider, but who just need to test. We have an online appointment-based system. And so while patients can get in that line and wait for their appointment, they can go on and do other things, do their shopping, wait from home, and then they get a text message when it's time to come in. So, patients as well as staff have to be patient, but we've made it as easy as possible without it really interfering with their daily activities, so they can come and get a test or be evaluated by a physician if need be.
Well, that's good to know. And we've also been reporting on a record number of healthcare workers calling out sick with COVID-19. How are you and your staff doing?
Yeah, I think we've been affected just like everybody else. I think, again, every industry outside of healthcare has been affected, but obviously during a pandemic and a health emergency, our healthcare providers, from physicians and APPs to front desk staff at our company, have been affected across the board. And so we've had to get very creative with staffing, because we have that need and that urgency to continue to serve our community. Our communities are in need, but definitely staffing wise, we've taken a hit. Fortunately, we've been able to not limit services across all of our facilities as a result. Again, that's a testament to our teamwork and our teammates who've stepped up when their coworkers are out. And the other good thing is, while we have a lot of people with a lot of illness, everybody's doing really, really well and recovering quickly. So we see an end in sight, I think.
Well, that's good to hear. I hope the
Yeah,
rest of
absolutely.
your staff who are sick get better soon. And
Absolutely.
there have been a lot of guideline changes as more and more
hmm
people get COVID-19 or live with someone who gets infected. What are some tips for those concerned about getting the virus from a family member or a roommate?
Yeah, it's the current concerns there. Again, I think with this surge and what we know about the latest variant is that while it spreads a lot easier than previous variants, the pathogenicity, or how sick it makes you, is less. And so, no matter what, if we're a parent with a little one that's sick or vice versa, it's really hard to distance, right, from our kids or for our loved ones. And so I think within reason, my advice to families are: be a family, you take care of each other. Invariably, some people are gonna get sick, and so distance as much as you can. If you're sick, stay home from work within reason. Don't go out to the grocery store, isolate amongst your family. Otherwise, as family and close friends, we have to continue to take care of each other.
And are there different guidelines for testing if a person previously had COVID-19 and is wondering if they may have it again?
So what we've known over the past couple of years changes rapidly, right? But we do know that an active COVID infection and people recovering from COVID infection does confer natural immunity. Now, I think there's a debate about how long that immunity lasts, whether it be 30 days or 6 months. And so people recovering from a COVID infection in the past month or even 3 months, I think have some pretty good immunity. However, viruses do what they do, so that they mutate, they change, their transmission rates change, and we do see people who have had previous variants they're affected again this time around. So I think bottom line, listen, if you have a concern, even if you've had COVID in the past and you feel ill and have a concern, let's get you seen, let's get you tested and find out for sure.
And never assume that just because you had it, you're going to be better off the next time, right?
Right. And, this time of year is pretty confusing because 3 years ago, in every year previous, we had cold and flu season, right? And so this is the season where flu viruses, although not as significant as previous seasons, as well as other common colds are out there. So it gets a little confusing when you have symptoms, especially with this more milder variant that mimic other cold symptoms. And so, but I think you're right. It's never assume. Let's get some help and get some questions and, some questions answered when you can.
Yeah, and we've been reporting that hospitals are struggling with staffing shortages, and
Mhm.
public health officials are urging people not to go to the emergency room unless they really need the services. Now, do you have similar
Right.
concerns about overcrowding at your clinics? I know you have that online check-in system, but in general, I
Yeah,
mean, if people get sick, they just walk in. Are you having that issue?
absolutely. So far, no. Our goal is really, and pre-COVID and now is to serve as a ER alternative. And so we really want to take the burden off the local hospitals and ERs and provide services similar to what they can do. And so whether it be through our online appointment system, our telemedicine aspect to our practice, or a virtual line where people can get online virtually and wait. Now, obviously, if somebody has an acute issue or is in distress, we want them seen immediately, and we'll navigate that and take care of it. Otherwise, for non-urgent things or emergent, they can get online and wait in a virtual line instead of having to crowd in our waiting rooms and out front. And so we're open for business. We're busy, but we're always happy to take care of patients, especially those patients with an acute issue that may not need to be seen in the emergency room, but do need to see a physician. The other thing is access to primary care right now is tough too. We've had a lot of primary care physicians who have gone out of practice as of the last surge, or they themselves are facing staffing shortages. And so we're happy to fill the gap and fill the void there too, while patients are trying to navigate getting back to their primary physicians.
Yeah, and I mean, we recorded our segment back in late October of 2021, and
Hmm.
since then, you
Yeah.
said you've opened additional locations throughout Southern California.
We've been very fortunate. So I think since we talked at our Torrance location, we've opened 3 additional locations: Huntington Beach, Irvine, where I'm at today, working clinically and seeing patients, and then a Lakewood location near Long Beach that just opened a couple of weeks ago. So, we understand it's a busy time, and our staffing may be a little bit thin, but I think we've got a great service that we offer, and right now the communities really need that service, and so we really feel the obligation to continue to push it ahead with our growth and get in the communities that need help and continue to do what we can to ease the pain and ease the burden.
All right, and any last thoughts for those concerned about our current situation?
I think positivity, right? I think, we're seeing a lot of sick people, that no doubt. I mean, I think our positivity rates for our patients we're testing is the highest it's ever been, probably triple what it was at the peak. However, I think everybody is doing really well. There are, people who with high risk or other comorbidities who have been a little sicker, but the vast majority of people we're seeing this time around are doing really well, recovering quickly. So I think just the message is continue to push through, do good self-care, positivity. We're already starting to see some of this surge drop off a little bit, and I think we're gonna have a good year. And so that's the biggest message. Just keep taking care of each other, keep being positive, and be a good force, a positive force.
That's a great note to end on. Happy New Year, and thank
Yeah,
you again so much for chatting with us.
always my pleasure. Thank you.
For the latest information on all things COVID-19 related, log on to torranceca.gov/COVID-19. And to learn more about Extra Urgent Care Torrance, go to the link on your screen. The Torrance Police Department is investigating a homicide and needs the public's help. At around 2 a.m. on January 24th, officers responded to the 1800 block of Del Amo Boulevard for an unknown trouble call and discovered a shooting victim who was deceased. Police say they take these cases of violent crime very seriously and has brought in all available resources to investigate. They continue to encourage the community to be vigilant of any criminal activity and say if you see something, say something. Anyone with information about this shooting is encouraged to call 310-328-3456. Torrance City Council members met last night to conduct city business. The council members adopted resolutions calling the 2022 general municipal election on June 7th. They also authorized staff to prepare an agenda item to submit for voter consideration a local half-cent sales tax ballot measure on the June 7th election. And the city leaders awarded a product services agreement in the amount of about $614,000 for the purchase and assembly of housing and accessory units for the Torrance Temporary Housing Program. You can watch full replays of the meeting on our website, YouTube, Facebook, and of course, right here on City Cable. The Torrance community is celebrating the life of former City Council member Bill Applegate today, who passed away on December 9th, 2021. A memorial service is taking place right now, and it's streaming live on the Torrance South Bay YMCA's Facebook page. Let's take a look.
But Bill was no saint. There was also a mischievous side to him, and many of you may have heard this, but he relished in telling the story about the consequences of city manager Ed Ferraro mentioned at a council meeting that he had an open door policy. Well, Bill seized on that moment, and at his instigation, he and I went upstairs after
Applegate served on the Torrance City Council for 16 years and was very active on the Armed Services Committee as a veteran. He was also a key leader on the Torrance South Bay YMCA, LA Metropolitan YMCA, and YMCA of the USA boards for more than 40 years. He mentored and worked alongside hundreds of volunteers and staff members and led a couple of capital campaign efforts that resulted in the state-of-the-art YMCA facility that our community enjoys today. Torrance South Bay YMCA's Executive Director, Steve McCollar, says no matter who you were, when you talked to Bill, you felt like you mattered, that you were important. Bill is loved and missed, but the YMCA community will ensure that his legacy of passionate, exceptional service lives on. If you missed the live stream due to watching our show, you can log on anytime at facebook.com/TSB campaign. Well, before we go, at the end of each program, we like to share feel-good stories from our community, pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. Today would have been Louis Zamperini's 105th birthday, and Discover Torrance's Debbie Hayes sent us this picture of her standing alongside the bigger-than-life image of our hometown hero on a mural located at 21250 Hawthorne Boulevard. Zamperini was a legend, an Olympic distance runner, and a World War II veteran. He attended Torrance High, where his love for running led him to excel at the high school track team. He set a world interscholastic record in the mile, clocking in at 4 minutes and 21.2 seconds. He got a scholarship to USC, where he set a national collegiate mile record that stood for 15 years, earning him the nickname Torrance Tornado. Zamperini joined the Air Force in 1941, flew several missions, survived a mechanical failure, and was stranded for 47 days in the Pacific Ocean before being captured by the Japanese Navy. He was held as a prisoner of war until the end of World War II, when he received a hero's welcome. Zamperini later became a Christian evangelist with a strong belief in forgiveness, devoting himself to at-risk youth for the latter decades of his life. If you want to say happy birthday to him, you can visit the mural painted by artist David Flores or our city's airport, which is named after Zamperini himself. Thank you, Debbie, for reminding us about this very special day and for caring about our local hero. Now, if you have a great story and an upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. We'll see you back here tomorrow as Bella Shaw brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.